Hey guys, so today I want to make a video about berberine because I love this natural remedy. I really recommend it for people who have digestive issues, who have intestinal issues like Candida, SIBO, leaky gut. So I will explain what it is and I will tell you how you can use it and for what conditions in particular. So what is it? Berberine, it's not a plant, it's a phytochemical. It's an alkaloid that is found in many plants. The plants that are most used for their berberine are Berberis vulgaris, so this is the Latin name. The common name is barberry. There is also Berberis aristata, I don't know the common name for this one. And there is also Hydrastis canadensis, and the common name is golden seal. So berberine has been used for thousands of years in Ayurvedic medicine and in Chinese medicine. It's only recently that in the Western world we started to get interested in berberine. So there have been several studies about berberine, but they are quite recent. So about the properties of berberine, it has many properties. We can almost say that berberine is like a miraculous remedy. Of course, I won't say that. I will never say that about anything because nothing is miraculous. I love berberine, but so to me it's interesting mainly for three different reasons. So as you know, I specialize in gut health. So I'm particularly interested in berberine for gut health. Berberine has antibacterial, antifungal, and antiparasitic properties. And it also has antibiofilm properties on different strains of fungi, including Candida albicans. A study shows that berberine destroys Candida albicans by degrading its membrane. Also, it's very interesting that berberine prevents the transition of Candida from its non-pathogenic yeast form to its pathogenic filamentary form. So if you've watched my other videos about Candida, so you know how Candida works, how Candida behave. So in a nutshell, Candida is a fungi. It is a polymorphic fungi. That means that it can transition from its yeast form to its mycelium form. So berberine stops that transition. It keeps Candida in its yeast form, in its non-pathogenic form. That's very interesting. For SIBO, studies in rats have shown that a herbal treatment with berberine works better than the conventional antibiotic treatment rifaximin with much less side effects. So we already know that. That's why on my channel I recommend natural herbal remedies and I don't recommend chemical antibiotics because that's how it works. Herbal remedies work at least as well as antibiotics, but with no side effects or much less side effects. Studies show that berberine improves gastrointestinal problems faster than antibiotics. It is effective against diarrhea caused by E. coli and it does not cause side effects. So berberine is usually taken orally, but it can also be used on the skin directly. So you can make a tea from berberine and you can just put it on your skin. It's efficient for burns, for any skin infection, for fungal infections on the skin. It's also efficient for eye infections, and you can make a tea and put drops of berberine tea in your eyes. Also, something that is very interesting that I really like about berberine is that it nourishes and repairs the intestinal mucosal lining. Berberine changes the intestinal flora. It lowers the number of pathogenic microorganisms, as we have seen previously, but also it increases the number of short chain fatty acid producing bacteria, especially the bacteria that make butyrate. So butyrate is a short chain fatty acid that is essential for the health of the intestinal lining. Butyrate nourishes and repairs the intestinal mucosa. So this is very, very important about berberine. It repairs your gut. So this is something we almost never hear about berberine. I've read that in one of the studies I've read about berberine. So what I tell you today in this video is just very short about berberine. If you want more details, I will put the link to my article that is on my website, and under my article you have the list of all the studies about berberine that I used to write this article. So if you are interested in berberine, I really recommend you to go have a look to those studies. It's very, very, very interesting. Also, one of the main properties of berberine is for its anti-diabetic properties. This is very, very important. Many studies have been done recently about that. Studies show that berberine can lower blood sugar, and it is used for people with pre-diabetes or type 2 diabetes. Studies have shown that berberine regulates blood sugar and lipid metabolism as effectively as metformin. So for people who are diabetics, they know the name of this drug, metformin. So metformin is a very common drug that is given to people with diabetes. So many studies show that berberine can actually replace metformin, and that's very interesting, I think, because metformin is quite a dangerous drug. It has very dangerous side effects. One of them is that it stops the absorption of vitamin B12. I think it's quite bad. And the worst side effect of metformin is that it can kill you by poisoning your body with lactic acid. So I am not a doctor, so I won't recommend you to stop your drugs, but do your own research. And I think it's interesting that many studies show that berberine can replace metformin very effectively and with no side effects. So for blood sugar control, you can take berberine together with other herbs that have been shown to also regulate blood sugar, like cinnamon, basil, or fenugreek. Milk thistle also. There are different studies showing that milk thistle helps to regulate blood sugar, and especially milk thistle together with berberine will improve that effect. Berberine also has anti-cholesterol properties. Some studies say that it could even replace statin drugs. So that's for the case if you think cholesterol is bad. Of course, I don't think cholesterol is bad, but that's another property of berberine. Berberine is a bitter tonic. It's a bitter herb. It stimulates the production and release of bile in the liver and the gallbladder, which improves digestion and detoxifies the body. That's another video I will make about bitters. That's very important. So yeah, bitters are one of the best things you can do when you have digestive issues. So berberine supports liver health, of course, as a bitter. All bitter herbs support liver health. For skin issues, also berberine is very interesting. Here we find again the classic link between skin issues and liver issues, and we know they are both related. Berberine helps detoxify the liver and therefore helps clearing out the skin. In one study, a group of teenagers taking 600 milligrams of aqueous fruit extract for 4 weeks so their acne decreased by almost 50% with no side effects. Berberine also has cardiovascular properties. Berberine is hypotensive. It is anti-arrhythmic because it reduces intracellular calcium, which is one of the causes of arrhythmia. It therefore also reduces the effects of caffeine. It reduces the risk of heart attacks, and berberine is also an anticoagulant. Many studies also have shown that berberine is anti-cancer, and it has very interesting properties also for the nervous system. So regarding the dosages, berberine has a short half-life. That means it is quickly eliminated by the body. So the regular dosage is 300 to 500 milligrams 2 to 3 times a day. And it should be taken with meals, preferably at the start of the meals. So I personally recommend the brand Dinveo. So it's a French brand. I know that they export in some countries in Europe. I've seen people who could order it in the UK. I'm not sure about the US, but I will. So the link is in my article. So if you want to buy it, to buy this brand, the link will be in my article, and the link of my article is under this video. Berberine is a very well tolerated supplement. It's very safe. There are contraindications, but it's nothing serious, don't worry. Studies show that long-term intake does not cause toxicity to the liver or the kidneys. One contraindication is that some people, some sensitive people, if they take more than 500 milligrams of berberine in one take, they can get digestive symptoms like cramps or diarrhea. There is also a risk of hypoglycemia for people who take medication that regulate blood sugar and who also take berberine together. You should change your doses of insulin and or metformin with the guidance of your doctor, of course, if you take berberine. People with low blood pressure should be careful with berberine also, as it lowers blood pressure. And as always, pregnant and breastfeeding women should not take berberine. As a conclusion, I really love berberine. I think it's a very interesting supplement that you can take for your gut health, and as we have seen for many other issues, for many other diseases. So for gut issues, I think berberine is especially interesting for people who have very sensitive guts and who also have a weak liver. People with a very sensitive gut and with a weak liver should not take oregano essential oil, for example. That can be too harsh. But berberine, on the contrary, is very gentle and very efficient. And it also helps to rebuild your gut lining. So it's great if you have any gut infection and if you have leaky gut. I love berberine for that. And I've never seen anyone reacting to berberine. So yeah. So and it protects your liver, and it's always interesting, to do something to support your liver while you're doing a protocol to heal your gut. That's it for berberine. If you want more details, go check out my article on my website. The link will be under this video. You can also join me in my Facebook group, the Candida Slayer forum, where I answer your questions if you have questions, and where I keep you updated with my videos and my new videos and my articles. So I see you soon, either on my website, on my Facebook group, or in my next video. Bye bye.